An ostomy looks like a small spout, created by bringing the intestine to the surface of the skin, and while this does look raw, it has no feeling or sensation. Waste matter leaves the ostomy and is collected in a bag attached to the abdomen. There are 3 types of ostomy. Perhaps the most well-known is the colostomy, created using the large intestine, and is usually found on the left side of the abdomen. An ileostomy is created using the small intestine, and can include the removal of both the large intestine and rectum, usually found on the right side of the abdomen. Both the colostomy and ileostomy can be temporary or permanent, depending on the severity of the condition. The final ostomy we will discuss is the urostomy. A urostomy is created using a section of the small intestine to fashion a tube connected to the surface of the skin directly from the kidneys, bypassing the bladder. A urostomy is a permanent procedure. So, why do we need an ostomy? Whilst an ostomy is normally associated with the older generation, there are a number of conditions affecting young people that may require the formation of an ostomy. The most common of these are bowel and bladder cancers, along with inflammatory bowel disease, which, over the last few decades, has seen a significant increase in the number of incidents reported amongst the younger generation. These conditions are potentially life-threatening, and for many, the formation of an ostomy is a life-saving procedure. FISHYS was founded by a group of young ostomates, introduced by the Stoma nursing team at the Royal Derby Hospital. Immediately following surgery, the group found that beyond the excellent care provided by the Stoma nursing team, the support network for young ostomates was severely limited. After several coffee mornings hearing each other's stories and providing emotional support, an idea began to develop to form an official support group. Friendship, Information, Support and Help for Young Stomates, or FISHYS, was formed in late 2013, and from the original 4 members, has now grown to include over 60 members. Currently, FISHYS provides support to those between the ages of 18 and 45 in the Derbyshire and Nottinghamshire regions. Whilst the upper limit of 45 is flexible, we remain focused on providing support to young ostomates living regular, active lifestyles. While the bulk of our membership originates within Amber Valley and Derby, we are beginning to gain traction in the border areas of Nottinghamshire also. FISHYS fosters a close relationship with the Derby Hospital Stoma nursing team and Coloplast, the primary provider of ostomy products within the UK. The close ties we have developed enable FISHYS to increase our reach within the local community and present significant opportunities, now and for the future. For example, our close relationship with Coloplast has recently allowed FISHYS to donate a significant amount of unused ostomy products to a charity in the Philippines, where patients will sadly not have access to ostomy bags and accessories, but simply use a carrier bag attached to the abdomen with sticky tape and elastic bands. On first contact with FISHYS, our members are often going through a difficult period of their life fighting a serious long-term health condition. The day-to-day reality is like being chained to the toilet for several hours per day. Severe abdominal pain, fatigue, malnutrition and life-threatening infections. Treatment can often be as damaging as the disease themselves, with medications such as chemo and immunosuppressant therapy having nasty side effects, often resulting in other serious associated medical conditions. Suffering from a long-term serious health condition may also take its toll mentally, as the symptoms can result in causing the patient to abandon higher education, lose a career and go through the breakup of relationships. Surgery is often the last resort for many of our members, which can lead to a lengthy stay in hospital and intensive care. So how does FISHYS help young adults adapt to life with an ostomy? These days, immediately following surgery can be a frightening time for a young ostomate. How to cope with education, work, dating and starting a family are just some thoughts that come to mind whilst lying in a hospital bed. Challenges that most of the older generation no longer have to face and that current support networks do not take into account. FISHYS have members who have done all these things, and it can be of immense comfort to speak to someone who has been there and done that. At the request of the Royal Derby Hospital Stoma nursing team, FISHYS has been to visit patients in hospital who are struggling with the idea of life with an ostomy. Hospital visits are a time when FISHYS are able to provide support when a patient is feeling most vulnerable, answering any potential questions, sharing stories of first-hand experience and ultimately giving the patient some optimism for the future. Following hospital discharge, FISHYS remain as a long-term support network. The collective experience of our members means that we have encountered nearly all of the challenges faced by a young ostomate, both medically and socially. Using either our support line or our Facebook page, members can take advantage of this experience and find guidance on a wide range of issues. Once a young ostomate has recovered from surgery, they may decide to attend one of our free monthly meetups at a local restaurant or public house, providing a platform for members to rebuild confidence in a social environment. Our meetups are an informal place for members to share stories, receive emotional support, and to ultimately have fun and feel normal. We have a firm belief that FISHYS is not just for support, but friendship too. We also supplement the monthly meetups with additional events that young people may find enjoyable, such as nights out in town, country walks, and various day trips. The final way in which FISHYS helps is by providing access to sample products and an emergency stockpile. Utilizing our relationship with Coloplast, FISHYS can supply members with sample products ranging from different types of ostomy bags to various sprays and creams. Occasionally a prescription may be late and a member may run out of a specific item. In this instance, FISHYS is able to provide emergency supplies until the prescription has been received. The FISHYS ethos is to provide support to young ostomates in a friendly, informal manner. We work with members on a personal level, helping them through the unique challenges that the younger generation can encounter while living a regular, active lifestyle. Currently, FISHYS operates within the Derbyshire and Nottinghamshire regions, with close ties to the Royal Derby Hospital. Our ultimate goal is to have FISHYS affiliated support group at every major hospital within the United Kingdom. In order to achieve this, the FISHYS Committee has identified 3 key areas in which funding needs to be invested for the group to develop towards our ultimate national vision. Perhaps the most important of these is raising awareness. Bowel conditions and ostomies are often a taboo subject amongst the younger generation, so FISHYS needs to make ourselves known to those suffering in silence and encourage young ostomates to talk openly about their condition. In the past, we have had significant success attending local fetes and conventions, selling raffle tickets and confectionery. We hope to build on this by travelling to other counties with the addition of FISHYS branded stationery, mugs and promotional materials, to include awareness flyers to hand out to the public. Currently, our ongoing support activities, such as hospital visits, depends on the generosity of our members. With parking charges, monthly phone bills and small visiting gifts such as sweets, the cost can quickly add up. We plan to facilitate our ongoing support activities by investing in an annual parking permit for local hospitals, upgrading our pay-as-you-go support line to a contract phone and setting aside some of our budget for subsidising various social events so even those who are on low incomes and have been through the ordeal of surgery can still have a treat day out. Whilst FISHYS have attended a training workshop on how to run a support group, the final area that we have identified for improvement is in the skills of our committee. The workshop does not prepare any of the committee members for supporting some of our most vulnerable members who may be dealing with a cancer diagnosis and other serious long-term health conditions at such a young age. Through contacts at the University of Derby, we potentially have the opportunity to send committee members on a part-time counselling course, allowing us to better support our most vulnerable and emotional fragile members.